The Scottish Government what its response is to the latest alcohol-related death statistics.
Minister Marie Todd.
Nobody should die as a result of alcohol consumption, and my thoughts go out to all affected. We're working with various organisations across Scotland, including ADPs, to address this issue. That includes piloting an innovative managed alcohol programme in partnership with the Simon Community Scotland, commissioning Public Health Scotland to review alcohol brief interventions, consulting on a range of potential alcohol marketing restrictions in Scotland, and fully evaluating minimum unit pricing. We support the principles of the right to recovery, and these will be embedded in the National Care Service, enabling everyone to access the treatment that they need.
Jamie Green.
Can I thank the Minister for that response, and I share her comments. Every loss of life is tragic, be it to drugs or alcohol. They are really Scotland's second national shame alongside our drugs crisis. The reality is that Audit Scotland are very clear about the scale of the cuts that were made as far back as 2014 to frontline alcohol services. That's why in my region alcohol-related deaths are up 10% in the last 4 years. That's why right across Scotland you're 5.6 times more likely to die of alcohol-related disease if you live in a deprived area. Can I make a plea to the Minister and the entire front bench of the government? Please listen to those on the front line who are desperately in need of support. They need help, and it's simply not there for far too many. Will this government double down, and I really mean double down on its efforts to tackle alcohol-related problems in society, properly fund them, properly resource them, given their notable lack of absence in yesterday's programme for government?
Minister.
So I absolutely agree that alcohol and drug-related harms are vitally important public health issues in Scotland. That's why we established a national mission to improve and to save lives, and at the core of that is ensuring that every individual is able to access the treatment and the recovery that they choose. Alcohol is a priority for the Scottish Government. Our alcohol and drugs teams work closely with each other. They share knowledge around what works and on ways to reduce the impact of addiction, as well as routes through to treatment. Alcohol-related and specific deaths, as the member says, are disproportionately higher in deprived communities, and that's why we continue to take a whole population approach when it comes to reducing alcohol consumption and the risk of alcohol-related harms. And this, in turn, will drive reductions in alcohol harm in our most deprived communities. We are also, as a government, taking action to improve the conditions which drive alcohol harms, reducing poverty and inequalities, providing good quality affordable housing, and enabling the best start in life for our children. I have to say it many times, though, it does feel like we're working with one hand behind our back in terms of how we give with one hand and the UK government takes with the other.
A supplementary, Monica Lennon.
Thank you, Presiding Officer. In light of this tragic public health emergency, can the Minister advise whether the Government intends to introduce an alcohol harm prevention levy on alcohol retailers to help fund alcohol prevention activity and these much needed support services?
Minister.
So certainly, as I've said before, I'm willing to consider all suggestions in how we tackle alcohol-related harm. The work streams that we have at the moment are many and extensive, and I would expect to deliver results. So I'm looking forward to seeing the evaluation on minimum unit pricing, which I think will be the most extensively studied policy that we've ever passed in this Parliament at the time we come to review as a Parliament whether it should be continued. At the same time as that, we'll also be looking at whether we have an appropriate minimum unit price. Of course, that was introduced, it will have been introduced more than a decade before, and I think it's timely that we review that. We're also looking, as I said, at alcohol brief interventions, those conversations that might open up and help people to consider and understand that they have an alcohol problem, where they can be used most appropriately and how we can maximise the impact from that. And of course, the alcohol advertising. We still, as the figures show, have a profoundly unhealthy relationship with alcohol in Scotland, and we need to shift that culture. And I think that tackling alcohol advertising will absolutely be part of that.
Question number 5, Mark Russell.